Hi, my name's Barbara Guinn. I'm a scientist working at the University of Hull, and I've been very fortunate to receive EACR-Novosanis funding that has allowed us to continue our research and actually move forward a bit quicker and do a bit more than we thought we were going to be able to do to start. So just to tell you a bit about endometriosis, it affects 1 in 10 women. It has some genetic elements like most diseases, and the biggest problem is that the symptoms are quite difficult to diagnose. So women will go to the doctors and they'll have pain, they'll have bleeding in weird places in their body, so they might have bruising in their legs or their stomach around the time of their period. These symptoms will get worse as they age. There is an increased frequency of infertility in women who do have endometriosis, and it can be incredibly painful. And that can be so bad that it stops women from being able to work and from having relationships because of the discomfort. Pain addiction to medicine can be an issue. What would be really good is to have a way to diagnose endometriosis much earlier than we do at the moment. So at the moment, women often go to the doctors repeatedly over a 7.5 year period, and they will keep being told that this is a normal period, that the pain they're experiencing is just what other women experience. And it can take a long time to feel like you're being believed and to be referred to a specialist centre. The only way to get a diagnosis at the moment is invasive, and it involves a laparoscopy, which is putting metal cameras inside the abdomen and having a look at how much endometriosis there is. And the only treatment at the moment is actually to cut away the endometriosis, and this can cause further problems with the tissue sticking and scar tissue. What we want to do is, with an earlier diagnosis, it means that women could get treated earlier, it would have less impact on them and less risk, the more chances of healing quickly and having less effects on their life. And so in my lab over the last 5, 6 years, we've started to look at endometriosis and whether we can identify biomarkers that would allow its earlier and non-invasive detection. And we've been able to identify some biomarkers, one of which has been shown already to increase in some people when they have other diseases such as Alzheimer's. And we now want to see if this same protein increases in women when they have endometriosis. So because of the Colli-Pee tubes, we've been able to give those out to women at the endometriosis clinic. They've been starting to use them. They'll hopefully give us some feedback on how they find them. And we're starting to look at ways to concentrate urine and then to look at the proteins in the urine and see, can we detect this biomarker? And if we can, how early in endometriosis can we actually detect this protein and therefore hopefully detect endometriosis? So I just wanted to say thank you to Novosanis for supporting our research. It's been fabulous working with Jose and Kay and the rest of the team, been very supportive of our work and very interested in what we're doing, and that is really nice. So I just want to say thank you so much. Really do appreciate your support, and I hope that this is a relationship that we can keep building on in the future. Thank you.